when GHC here was being thought, it was just sort of, you know, a concept in people's hopes and fondest thoughts, but that it would actually happen, I will tell you, at the beginning, I never would have thought it would. The medical community here was adamantly opposed to it. We felt they were already over-doctored. They did not want this to get off the ground.
The established medical community wasn't real happy about group health coming in and starting this new concept, especially not just the provision of health care, but the concept of community, of the membership involvement.
Before we were granted federal funding, we had people calling Kastenmeier's office, lobbying, just doing everything we could to keep our doors open.
The normal system is the doctor says do it, you don't ask questions. In group health, you ask questions. You're expected to. You're part of the team.
We are not driven by a bottom line every quarter. We do not have to provide stock value, and instead our value is back in terms of care to the individual member.
Because it's a cooperative, I have input. I have the opportunity to participate. I have the opportunity to select the people that represent me. And I wouldn't have that anywhere else, not in healthcare.
It's been, I think, a kind of quality of service that I don't believe we could get anywhere else.
I will always think of group health as Ray's dream that came true, and that for him, probably the thing in his life he was most proud of.
I often wondered if we would survive, but somehow I always felt I knew we would, because it was a good idea and it was a good thing to do for the community, and there were good people doing it.
The sense of pride in that this was the early days for HMOs, and that we started here and that we succeeded.
Group health cares about you and about the patient and the community, because they're part of it, a big part of it.
It's still burning today. It's still an exciting thing to be part of.
This organization would not quit. It would not quit.
It's resourceful, it's responsible, it's responsive, and it's respectful.